Just felt like talking about my brain tumor blood test result from the novel test that I had, which has had a lot of noise recently. A lot of people are very excited about this test. My test was positive, which I was kind of expecting, because what it looks at is it's looking at the blood samples that I took to detect a protein called GFAP, glial fibrillary acidic protein. I think I got that right. And this protein is found in astrocytes, and it's to do with the kind of structure and integrity, I want to say, of the which supports the neurons and the blood-brain barrier. And so this test is indicated for people who aren't in my specific situation, but it is to identify glioma brain tumors. As I mentioned, it's also, well, I did some research into the protein, and it's interesting because the test is said to be, I think it's right, 99%, has a 99% specificity and a 96%, something like that, of accuracy. However, that's in those indications that have been tested for. So my positive result isn't really sending me into a panic, because I feel as though there are many other variables. There's a lot of, if it was like trying to use like a proper analogy, it's like there's a lot of noise. There's disturbances from other phenomena that's happening in that area of my brain where the tumor was. And so if this is a marker of neuronal degradation or structural breakdown or some disturbance, that's not allowing it to maintain that mechanical strength, which is what the GFAP protein is. You have more of it when there's that disturbance. If that's the case, then I know that it's been shown with other conditions that are associated with neurodegeneration. Like I know that it's been detected in the blood of the circulating, in circulation for away from the blood-brain barrier, but into the blood samples of for people with other conditions like Alzheimer's. So it's been detected in the blood. And so it's not necessarily an indicator just for high-grade glioma, which is kind of what the inference was with the test. So it's you can read it as, which is what I'm doing, is it's kind of like marketing spiel where they suggest, oh, this is there's no like ambiguity here, it's so specific. However, there could be cases where there are other other issues. And because it's not indicated for my specific situation where there's no visible tumor on scans, there's no real need for me to go crazy about a positive blood test. Because I have some remnants, if you want to say, some scar tissue, and some hemosiderin, which is like a blood staining in the area where I had the tumor. And that, yeah, the hemosiderin that I mentioned, the blood staining, can be so problematic and troublesome to the point whereby if there's blood rushing to that area, it can have that hyperexcitability of those areas that cause my dysphasia, which is why that happens when I become overstimulated. And so there would likely be, not necessarily in abundance, but some of that protein being expressed. This is all like theoretical, but it makes a lot of sense with the mechanisms when I've looked into it. There likely could be, how did I phrase it? Not in abundance, but yeah, detectable protein there present. And so, yeah, and also anytime you've had any kind of treatment, surgery, maybe if you've had radiotherapy or anything that's disturbed the blood-brain barrier, for a start, any kind of brain tumor is going to give you this kind of leaky brain phenomena where the integrity of the blood-brain barrier is compromised. And so it makes sense that you're likely to get some of this coming into the bloodstream. And even though it's termed as being circulating tumor cells or circulating cancer cells, it's not necessarily the case that this is cancer related. For example, I know someone who definitely does not have cancer, but they have metabolic derangement, let's say, a metabolic imbalance, dysregulation. And they did a test, and these kind of tumor markers, or what you'd associate with like a cancer phenotype of some origin, some sort, were elevated. And they don't have cancer, but it could, if they're maintaining that state, then yeah, they maybe could in future. Maybe it's just linked with some type of inflammation in that area. So these tests maybe aren't as specific as they would like you to think. That's why I think it would have been interesting to do tests on more people like me, where I've had a history of brain cancer. Technically, according to the test, I still have brain cancer. But as I say, could just be inflammation in that area that's compromising the neuronal integrity in that area. So it makes a lot of sense. You could potentially, I would love to see them test against other conditions rather than just people who don't have brain tumors and people who do. So let's say you have someone who has a migraine disorder. Are they going to have more of the GFAP protein as we see with Alzheimer's disease? What about certain types of epilepsy. You can see with functional MRIs that there's activity in those areas. You can see with EEGs, because with my type of epilepsy, I now only have non-epileptic seizures, which won't show on an EEG, but they will show on functional MRI. And so, yeah, initially I had most of the tumor removed. There's a question about that, which is why I'm just answering it. Yeah, most of the tumor was removed in early 2013. And then over time, possibly due to my interventions, the enhancement that was shown on the scans dissipated to the point where we couldn't see it anymore. And then I was left with the question, well, was that, because these scans can be fairly ambiguous, was that really a complete remission? Because it's been over 11 years now. Is that really like, a complete remission? Or even was it showing some type of other activity that's not malignant? And I also had MR spectroscopy at the time, and it did those peaks and troughs that you see, which show the biochemical demands of that area, which confer the different kind of fuels, the metabolites that are being taken up. Just thinking if I'm using the right terminology, but I think I am. I'm always like unsure of myself, but I know what I'm talking about. So yeah, that seemed to pair with being possibly, most likely, disease or some type of some type of tumor activity, but could have also been epilepsy related, but I don't know, or both. But it's still an interesting phenomenon that it disappeared, and has been that way ever since. So I've been curious about this kind of test and whether that could detect anything, any microscopic cells that we might not be able to see via the circulation in the blood. And I know you can also detect different types of brain tumors now through the urine, because you can pee out these circulating cancer cell associated proteins, I want to say. So yeah, GFAP is one of those, and that's what the test was looking for. And I have a consultation with an oncologist tomorrow about my results. And that's what you have to do if you have a positive result. You have to have a follow-up. Before I had this test, I had to have a psychological assessment. And I said, well, I treat myself like I've still got cancer anyway, so no rest for the wicked, as they say. I think in my last video, I spoke about just my mental health. Actually, today is pretty good, and I've got plans to, because I was thinking a lot about what makes me happy in life, and I've got plans to really step up on that. Yeah, to really just go with self-improvement strategies to improve that. And so, yeah, the question throughout this whole time period has been, have my actions contributed to the dissipation of that signaling activity, that signaling and that enhancement that was showing on my scans? and we don't know. It's speculative, but it's very interesting. It paired with the time period that I was on sodium valproate, which I've mentioned many times now. People are probably bored of me mentioning it, but I feel like it's important to mention because it has anti-cancer action against glioma, and it's an anti-seizure drug which isn't always prescribed, but there's a lot of evidence to suggest that it should be, and it complements a ketogenic diet very nicely, and just metabolic approaches in general. And so if I were to have a recurrence, I might consider it. Unless I was planning on having kids at some point, if that ever happens. But yeah, because it can cause deformed kids. Even for the male, even for the father, it can make your sperm all funny. I remember I had a sperm test. I wanted to use the right word, but yeah, like an andrology test. And it showed that when I was on this drug, it showed that just the little swimmers, they had some of them had two heads or funny tails, or were just swimming like they were drunk, and some were completely almost dead and just kind of squirming around. Some had really small tails, and it's really interesting. It's interesting how much you can actually learn from those tests as well. So you look at mineral status and a bunch of other things, which, yeah, it's very interesting. I found that interesting. At the time I was thinking, is it because I have my phone in my pocket that it's causing this kind of sluggishness of my little swimmers in there? But yeah, after that anyway, I just stopped doing that, or I had my phone off when it was in my pocket. But I don't think it was that. I think it was this drug. Because when I came off it, I did a retest. The retest was actually 10 years later. And yeah, it's they were very healthy. I was in like the top 1% of samples that they had in terms of the motility and the morphology rating and all of these things. So I know a lot about fertility from this, which is good. It's useful, maybe. I don't know. Hopefully it's useful in future. So yeah, I've learned a lot. Tomorrow I've got my consultation with the oncologist to talk about this test. And I want to go over some theories with him. Because I don't think that they receive these kind of questions, or they don't have people in my situation who are doing the test for the purposes that I was doing it for. I want to learn. I want to figure things out that we don't currently know, and I want to push the boundaries. I want to try something new, and I want to see if I can, if it is purely cancer related, and there's these microscopic cells that we can't see, it would be really cool if I could just obliterate all of them. Because we know from some case studies that people doing these metabolic approaches for high-grade glioma, what happens if they relax a bit too much, the tumor comes back with a vengeance. And so if I can stay one step ahead, or a few steps ahead, then I think I've got a pretty good chance. And yeah, a lot of that's driven by feeling like if I did see something visibly on a scan, at that point you've got billions of cells, even if you have like a little smudge. And so you're racing against something that is, at least if you have a recurrence of high-grade glioma, is going to grow very quickly. And so yeah, when you're in that position and you're making decisions out of fear, you don't always make the best decisions. You're not able to think with clarity. And so in my situation, even if I have this tiny, tiny signal, and even if it's not specifically cancer related, it's not good to have sustained inflammation in that area. And so if I can do anything to improve that and push myself in a kind way, not like kill myself, or almost kill myself, then yeah, I've got a really good chance. And I'm a lot more optimistic than I was a few days ago, or even just after receiving the test, because at that time you're kind of confused and a lot of difficult emotions are going through your head and trying to make sense of everything. But I think I'll be able to ask the right questions tomorrow. If anyone's watching this and has any ideas of questions that maybe I could follow up with, that they might have the answers to, or might be interested in knowing more about and finding out for me, that would be cool. Because yeah, it's a learning journey. So yeah, if I have inflammation in my brain, I have cod liver, not cod liver oil, but the actual cod liver. And for that day, I would I would do fasting, but I wouldn't just fast all the time, because your brain also wants nutrients and it wants fuel. And it thrives on fat, particularly animal fats, particularly DHA, the long-chain omega-3 fatty acid, which is the brain's largely composed of DHA. So it makes sense, and it has that anti-inflammatory effect. And so, yeah, high omega-3. I also take Boswellia serrata if I have like a headache or some issue there. Also, I make sure that if I'm inside, that I have good ventilation, because if you're in a stuffy room, that's not good. If you got a headache or anything brain related, that's not what you want. Breathing is very important, and having good air quality. Having lots of houseplants helps as well if you're inside. It helps the air become more pure. There was actually a guy who was responsible for the famous NASA study on that, and I tried to contact him, but I didn't realize that he was in his late 90s at the time. He was about 98 years old, and he actually responded to me. And I was thinking at first, he actually responded just saying that he was long retired, and also he's not in a great state health wise, but he wanted to thank me for my interest. Yeah, he's 98 years old at that time. It was a few years ago now. And he was, just like this big, important person in NASA. Wanted to interview him, but yeah, he's pretty old. But cool that he's still alive. Probably not now, but hopefully. Yeah, air quality is a big problem. There's this condition called, I think it's like sick building syndrome or something like that. It's quite concerning. Just there are lots of these buildings that just make people have all these horrible symptoms, and it can be cumulative, so you don't necessarily know straight away. But yeah, I've done lots of I've had lots of air purification systems in the past, and monitors and that kind of thing. And where I am in the UK, it's not a problem in London, but or it could be in some buildings, but in some areas of the UK, you've got uranium in the soil, and it can get trapped in buildings as radon gas, and that's the second leading cause of lung cancer. And it can contribute to other cancers. So I often wonder in these areas where there's uranium in the soil, how that's affecting people, say, if they want to do grounding or if they want to eat food that's produced in the soil in that area, or if they drink from reservoirs where there's, the uranium in the soil. If that's a risk of anything, but I don't know. Yeah, mold is a big issue as well. In the UK, there's all these really old houses that have just not been looked after, and they can have these problems with mold and damp. You need to really keep on top of that and investigate it. And it can be quite hard to get rid of as well. One that's really good, people talk about this a lot now in the kind of ketone carnivore space, is deuterium. And say if you have a room that can get stuffy, in the water vapor you can have a lot of deuterium, and so if you have a dehumidifier in your room, that can be very beneficial, even if you don't have problems with the damp and the mold. If you have a dehumidifier and you have some houseplants like the ones behind me, it can help. That's my top tip for the day. Also, just having that ventilation, having windows open as much as you can. Yeah, I just had a few thoughts in my head, so that's why I felt like doing this live video. And I'm feeling more confident about certain things, so I'd like to start up my podcast again, because I have a few interesting areas I'd like to cover. I only had my podcast initially because there were certain topics that I wanted to cover that weren't on other health podcasts, let's say. Don't know if I'd call it a health podcast. It kind of is, but it's mostly brain related and mostly brain tumor related, but touches on a lot of really interesting, or at least I think interesting, subjects. So I covered gadolinium. I covered, which is the contrast agent used for a lot of head and neck imaging. I covered that. I covered cancer clusters. In a roundabout way, I covered immunotherapy. Different things. And yeah, I'd like to cover a few other, human guinea pig project. I think, yeah, it's been so long since I've done it now. But yeah, there's a few other things I'd like to cover, and a few different areas I'd like to highlight which haven't been highlighted. And I've decided that, because one of my issues was, if you do any kind of podcast and you try to have a guest on, you spend so much time trying to find an available slot that you can both agree on. And so I was thinking about that, and I was thinking, well, you don't always have to interview someone. You can just talk about something and have the relevant literature and evidence and the proper evidence to back up anything that you say, any claims or any interesting insights. And so, yeah, I'd be really interested in doing that again. So I write about a lot of these things on my Substack, and I'm very thankful for the people who subscribe to that, because it really helps me in a big way with my research. And the people who are paid subscribers, for the people who are paid subscribers, it allows me to generate more meaningful content, and it allows me to do more experiments, and allows me to do more with the research that I'm doing in the lab as well, because the majority of the money goes to that. I don't really have much money for other things. I'm even moving soon to an area where I don't have to pay as much, and so I can have more money to spend on just making the most of that area, just the research and the things that I'm doing, the experiments I want to do. Not just experiments that are in the lab, but on myself as well. And tests and that kind of thing. Yes, I had brain surgery to remove most of the tumour, and then the residual disease that was showing on scans had seemed to have become no longer visible on scans. And I have to be very careful with the words that I use, because I don't like to because I'm a scientist, I don't want to say anything that we can't definitively say. Is like the term would be the accurate term would be complete remission. That's what, or no evidence of disease. That's what comes up on my clinic notes. But that's one of the reasons I wanted to have this test, to see what that actually means. Because I don't think you can ever actually you can have these tumors completely cured, but the only way you would know definitively is via an autopsy. So yeah, so because we don't have that, just gonna say complete remission. And this blood test suggests that maybe I still have the cancer. So it's about when I die, it's about dying with the cancer rather than of it. So my MRIs are still clear, there's nothing there, but my my cancer blood test, which is specific for glioma, the one that I had, that tested positive. But as I was mentioning earlier in this stream, that could mean a number of different things. Doesn't necessarily mean it's cancer related. It's related, but not directly related, potentially. It could be potentially related as well, so it's confusing, and we might not ever know. But that's life, isn't it? You don't. And actually, also, I should probably mention that with this test, at any point of time within those 11 years, it could have been positive throughout that whole time. And that in itself is a fascinating result, because what we have highly aggressive brain cancer, which has had that state of no evidence of disease, has had that sustained for so many years without doing anything like nefarious. So that's pretty cool, actually. So any result is actually a good result in this case. It's one way to view it. So am I glad that I had it done? I'll find out tomorrow, I guess, upon further investigation and further interrogation of the oncologist who I'm going to be grilling tomorrow. He might actually ask me some questions, because I had not a great tumor, and I want to also ask if we can do further investigation on those blood samples to attempt to assess more about those kind of fragments of whatever of diseased cells or whatever, if that's what it is, to interpret aggressivity perhaps, or the degree of that protein that they could quantify, to see if that means anything in terms of risk of recurrence, like a date, like a vague, it would have to be a vague like prediction, but I don't see why it wouldn't be possible. Or even degree of neuroinflammation, if that's what it's showing. But yeah, interesting stuff. I know they have a separate test, which is for dictating treatment. And so I'd be curious to know, okay, can we now do a follow-up test? And instead of treatment with chemotherapy, which would never do, or although I say that, there's only one type of chemotherapy I would do, and it's not the standard one for a high-grade glioma. It's a different type. So the longest term survivors of particularly glioblastoma that I know, and the ones that did chemotherapy, they had tamoxifen. And normally you would have temozolomide, or you would have PCV chemo. But the longest term survivors, they all had, who had treatment, they all had tamoxifen, which they don't really like to give you. Why is that? If it has these, if such a, I'd say a large percentage, but it's like a small minority, like a large minority have had this. Yeah, it's interesting, isn't it? It throws up some interesting questions. Even Ben Williams, he was diagnosed with the glioblastoma in 1995. He had tamoxifen. And the theory is that the drug cocktail that he put himself on, of these repurposed drugs with metabolic actions, metabolic targets, that combination allowed the tumor to be sensitized to the tamoxifen. And it's also likely that his tumor was more hormonal. So I think tamoxifen you have more for things like breast cancer. Yeah, he had some brain tumors are more hormonal. So they respond better to hormonal therapies. And you probably have a benefit with some female patients compared to males in those cases, because hormones like progesterone are neuroprotective. And so, yeah, I've always found that quite interesting. And you can have HER2 positive brain tumors, just like how you can have HER2 positive breast cancers. So as brain tumors, you can have a hormonal element. You can have alterations in brain chemistry, whereby there's loads of these, well, I say loads, there's at least a handful of these case studies where you have people who go on antipsychotic medications, people who are on antidepressants. There's a certain class of antidepressants called tricyclic antidepressants, and they can have potent anti-cancer potential for brain tumors, specific types of brain tumors. And so, yeah, in certain individuals, altering that brain chemistry can cause tumor regression. And I often wonder if that's reversing a phenotype that has led to the cause of these tumors. So, for example, in my case, I had clinical depression before my diagnosis, and I had this from a very young age. And we know that being in ketosis can alter brain chemistry favorably. You have an increase in GABA, and a bunch of wonderful things happen as well related to the ketones. And also just having your blood sugar lower consistently and lowering IGF-1 and all of this stuff. And so it could be in my case that I've managed to more favorably alter that kind of less favorable brain chemistry that could have contributed to the tumor forming. And also sodium valproate, the drug that I mentioned before, the anti-seizure drug, is also indicated for bipolar disorder and certain mood disorders. And so that could be another reason why it's beneficial for certain individuals, maybe not everyone. But it has numerous benefits. That's just one of them, potentially. And so, yeah, there's all these things, and I do actually think that there's some variability here, whereby there are certain types of patient, certain types of individual who, maybe if we look at the origins and the potential reasons or contributory factors to how these tumors formed, then maybe we can look at these things like the brain chemistry, the hormones. Maybe if someone's been exposed to VOCs, volatile organic compounds, like vinyl chloride and trichloroethylene, which have shown to cause brain tumors and thyroid cancers and lung cancer. Maybe if we have something that can reverse that, then that's the best approach. We need to look at the origins more, because it's not just about diet and being in ketosis, but that puts you in the right environment to then find those other solutions. Yeah, I've noticed quite a few people who have brain tumors have autism, which is interesting. I do have lingering symptoms. My speech is a bit sluggish. It was quite different before my diagnosis. It's a lot easier to speak. I have to think about every word that comes out of my mouth, and it can be very frustrating. Sometimes I speak a bit sluggishly, or the speech can completely go if I'm stressed or tired, or if my blood sugar goes too high. And I've had to get used to it, because I used to be a lot more confident with my speech before the brain tumor. Yeah, that's another thing. I've had to maintain a very calm state. Also because, well, being in ketosis helps me with that. But it's like a cycle as well, because being calm helps you sustain deeper ketosis more frequently, more consistently, and more consistent ketosis in those ranges makes you more calm. So yeah, it helps. And it helps to be around positive people, which I am at the moment, which is very welcome. I've learned a lot over the years, through a lot of trial and error, and also through reading. Not the easy way, not the way you want to. I haven't done the Grail test, but I have done one that's very similar, which I will get results in about 3 weeks, I want to say. Yeah, 2 or 3 weeks. But yeah, I hope that one's hope nothing comes of that one, because that's like a general screen for lots of different cancers. So yeah, I don't want that one to come back positive for anything. I don't think it will, but it's all interesting, this new age of all these different tests and what they mean, and we're still in the infancy of this, so We can't go crazy over it, even though they're getting a lot better. Because as I say, you can have false positives, and there could be a number of factors for that. Could just be inflammation or other, metabolic dysregulation. So you have to be careful with these results. And people sometimes downplay that being positive, but it's hugely beneficial for your whole physiology. Just puts you in a much better state. And there's a reason why there's a placebo effect and a nocebo effect. It's because it's a real thing. So if I can live in a placebo state, then that's great. If I can do everything with intention and with positivity and imaging that positive scenario. Thank you for watching. Appreciate it. I'm thinking currently about what to do with my evenings because I've noticed a concerning pattern whereby I can be consumed by negative thoughts or intrusive thoughts in the evenings. I can have a fantastic day for the whole day, and then evening comes and the dark clouds gather. Not on a ketogenic lifestyle even before. This was before the brain tumor. So we're going back many years, but I often wonder how bad this would be if I wasn't in that state. But I am mindful of wanting to continue having more, because I'm a very deep thinker, so evenings make me think too much, and I want to have positive routine in the evening. And I think I'll do some evening streams with just some thoughts and maybe some activities, and I might have someone join me. I know that Isabella, my friend and colleague, is interested in maybe joining me for like a regular stream, and then we can have like a Q&A thing. That'd be cool. Could just have fun too. It has been improving as it's been lighter in the evenings, so that's really good. Just my mood. And also just visualization, which is something that I used to do a lot more often, which I kind of stopped. You can't sometimes get a bit lazy with these things, but then you realize how crucial they are for just maintaining your sanity when you stop doing them. But when you get into that routine, it just becomes normal. I'd like to, because I had a keyboard I used to play music on, the piano type keyboard, and that really helped me, but then it broke and I have to get a new one. But I found it very relaxing. I like it. I'm going to get back into music. I'm not very good, but I really enjoy it. And I like to journal. I want to get better at drawing as well. Definitely. I definitely need a break from all the cancer stuff. It's pretty heavy. heavy stuff. And I'm in contact with a lot of people who are not doing very well with the whole cancer thing. So it's good to have something else. I think it's good for the brain as well. Yeah, I can play my bad music to you. And then maybe, yeah, in time we can see like an improvement. One thing I really like doing as well is I've got a pull-up bar on the door just there. Every time I walk past it, I just do a few pull-ups. And it seems to just I do it more because it really helps my my posture, and I have less tension in my shoulders, in my trapezius. Maybe I'm doing pull-ups wrong, but I do try and do them very slowly and deliberately. But yeah, I just do a few every now and then, and it helps to keep me alert, and it feels good. Mostly when I do exercise, it's for my mental health rather than anything. For example, I like to run, but I don't run too long a distance. I just do short distances, and I do it just for my mental health and for the social reasons. I run with other people. I wouldn't run for fitness because I think there are better ways to get fit. I'd rather do weight training for that, or some type of resistance training. But I enjoy running. It's very meditative for me. I think a lot about my breathing, and I take in nature. I would never do it in a gym. Don't like gyms. Yeah, I tend to do. I don't really go. The longest I'll do is 10K, but yeah, mostly I do 5K. And because I'm quite fit, running 5K feels like walking, doesn't feel like a stress on the body. And I usually end it with a sprint. So yeah, it doesn't feel stressful at all. Even the sprint just feels very natural. It's not laborious. I don't feel completely out of breath. It's like if you're a child and you're just running around, It's enjoyable. It's not like you're feeling tortured. And yeah, I think a lot with exercise, I think a lot about my breathing. But it becomes so measured and so autonomous that after being conscious initially, I just don't think about it, and it's nice. It just helps my brain so much. It clears my head and everything. But yeah, I only run once or twice a week, and only if I don't feel like I'll go for a long walk instead, and always in nature. And if I'm really stressed out, I won't run. I'll walk. I'll never run if I'm stressed, or if it's the end of the day or anything like that, because I think that's not good. It's too stressful. Everything I do is to reduce stress. I find it interesting too how I feel as though my lifestyle allows me to when I'm doing these exercises to be I seem to be fitter than people who train multiple times in the week. Yeah, so I find that really interesting because I do minimal training and I still manage to keep up with people who are quite fast or quite fit. And I don't have like a proper training regime. Even with the resistance training, I just do a few pull-ups here and there or a few push-ups, a few squats. And I try to make it enjoyable. Make games out of it. Yeah, I'm still in touch with Jane. Really appreciate what she does, what she has to offer. She said a few things about ketogenic diets which are not true, which needed correcting. But I think overall she's doing really good stuff, and she doesn't have any. She sacrifices a lot to do what she does, and she just wants to help others. She's a lovely person. Just really, yeah, she really is. And she's just got huge demands on her time. I think it's very commendable what she's doing. And in some ways, I think it's actually really good how she doesn't advocate going on any kind of really strict diet because it's not for everyone. I do think, though, for brain tumors specifically, especially with the kinds of symptoms you can get, then a well-formulated ketogenic diet is the way to go. I can't say that for all cancers, but a lot of brain tumors, yes. Especially if you have symptoms. And the thing that clouds things, the thing that makes it somewhat confusing perhaps, is that clinically there are at least 4 or 5 different types of ketogenic diets that have been used for different neurological disorders, mainly epilepsy, drug-resistant epilepsy. So if you have all these types of ketogenic diets, and then you also have things like intravenous ketogenic diets, and there's another one as well, which I can't remember, but yeah. There's intravenous, and then there's like yeah, I can't remember. But yeah, different types, as well as the classical ketogenic diet, the MCT ketogenic diet. You have exogenous ketones as well. You've got ketone esters, so you've got exogenous ketones, you've got ketone salts, and you've got the ketone esters. And the ketone esters are more potent. So you can rapidly increase it. Interesting, you mentioned, is it cavernous hemangioma or cavernous angioma, they say in America? Because my brain tumor was encased around a cavernous hemangioma. So it was a 2-in-1. And there are some cases of that in the literature. It's extremely rare, but it can happen. It's one of these bizarre things, but kind of kind of worryingly, we're seeing this more frequently over the past 10, 10 or so years. We've just seen more of these things happening. It's quite concerning. So yeah, because ketogenic diet is in part an anti-angiogenic treatment, as well as just fasting in general and fasting mimicking diets, then it can have great efficacy for cavernous hemangioma or cavernous angioma, however you want to say it, or even an AVM, something like that. Mechanistically, at least. So, yeah, I think that's it for now, but I'm in a good state at the moment, and I hope to get on with the podcast and get that back up and running. And yeah, I look forward to seeing more of Jane's podcast too, because that'll be good to keep up with. It's always good to hear from other people and get insights from that, and we can all learn. Okay. Have a good, I was going to say evening, but have a good time wherever you are, and see you soon. Bye.